Early in my career, I was working in the Bronx in this small hospital called Our Lady of Mercy Medical Center. One night, I was doing my night shift, and there is this 20-year-old girl, African American Spanish mix, and you would call her a mulatto, I would assume. And she came in with complaining of a lot of abdominal pain. And I looked at her, and I figured she must be pregnant. So I sent her up to the maternity ward. And about an hour later, she came back. And I said, "What happened?" She's like, "Well, they told me I'm not pregnant and I'm having a lot of pain." So I put her in an exam room, and I had a lot of patients to attend to. I was examining this old lady when I heard screaming coming out of her room. I went over there. She was writhing in pain. It's hurting so bad. I gotta go to the bathroom." And she went into the bathroom, and I followed her. She was in there in the bathroom, squatting down and pushing. And I was able to see this tiniest little head crowning between her legs. And I was like, "Oh my God, you're delivering. You cannot be over the toilet." So I grabbed her and moved her into the next door and put her in a GYM bed, propped her legs up, and I'm calling for help. "Help, help, I need help, there's a delivery." And then, of course, everybody walked into the room. And as soon as they discovered what's going on, immediately, boom, they all disappeared. And here I am, all by myself, with this girl, writhing in pain and pushing. So I had to go through the motions of delivery. So I had first one shoulder, the other shoulder, and pretty soon I have this tiny, teeny baby, about 24 weeks old, coming to life. It was adorable. I clamped the cord with my fingers, and then thankfully people walked into the room. And I was able to suction the mouth, cut the cord, bundle the baby, and then we sent the baby up to the neonatal intensive care unit. And that was about, many, many moons ago. Against all odds, that baby did very well. She survived. And probably you're wondering what I'm talking about this in NASDAQ. I'm talking about this in NASDAQ because there's this force of life. There's this force of life that's so powerful within us that is unable to be contained. It will thrive despite being unplanned, despite being immature. And that's kind of how I transformed out of emergency medicine as well. I've been practicing EM for many, many years, and I've grown disillusioned with the current medical model of treating patients with pills and prescriptions. And I had this burning desire to help people to feel better and healthy from within, regenerate, look better, feel younger, and all from within. And and that's how my practice actually came to this world, a lot like that little baby with a life of force. So if there's anything I learned from this and throughout my career is that there is this passion in people, and it sometimes delivers incredible things. Thank you, NASDAQ.